I will tell you today a little bit about Estonian digital license market. And when we talk about Estonia health in this regard, that digitalization in Estonia in life sciences has mostly happened in health technologies. And just before we go forward, I would like to mention that views here are not official views of European Commission or the ESME, and of course, to this or that you may get from my presentations cannot be traced back to European Commission or to ESME in any way. So, briefly about the general background of our general situation in the health technologies. So I think these three topics are not news to anyone, and the general background in the healthcare systems is that they are facing, and all the, at least in the Western world, all the societies are faced with increasing cost of the healthcare. And there are many drivers behind it. One of them, and that means that there is less and less people who are willing to pay for the service if this is if the service is maintained centrally by the state, and there are more and more people who want to use it. So of course this sets the balance. If there are less payers and more users, then the balance will be towards higher exploitation of the resources. And what's been also discussed quite a lot is that due to the relatively increasing cost and more people using the system, the access is rather sometimes limited, and for example in Estonia, getting to a specialized doctor can be sometimes rather tricky, and I think this is important also in the context of Estonia, as we'll later show you that we are developing set of digital tools, or thinking towards digital tools, how to reduce the doctor queues at the doctors and make the overall healthcare system a little bit more sustainable and easier to access. And when we talk about increasing cost, then also some increase comes from recent drug developments, where quite many challenging diseases have found treatments which are often quite expensive, and what we see in Estonia is that these new developments seem to be a bit too expensive for Estonians sometimes, and it's difficult for the system to maintain these kind of treatments. Now a little bit about the country context. As you may know, Estonia is awfully small region. If you look at that, we only have less than 1.3 or around 1.3 million people. So this is not considered really a market. I will hopefully come back a little bit later to this, that we are seen often as a test market, as a digital country, and good access to healthcare. So we're sort of, especially from outside Estonia, we could be a stepping stone to future European markets. In our living standard is I would say in the middle of the pack in EU, as it is also with the physician density, nurse and midwife density, and I think also with hospital bed density. So we're rather a common European country. As it also goes to life expectancy. Now, when we reach the total health expenditure of the GDP, then in EU, Estonia, I think, is third to last or fifth to last, or in this range. So there are two things to understand here. One is the total amount of money that goes to the health system is low, but secondly, the ability to create value from this funding, I'd say that Estonia has been quite good in this sense, that the relative level of healthcare has been acceptable, and regardless of the service has been maintained and managed in a good way. And I think the internet users percentage is a little bit higher these days. I think we have crossed the 90% line, or did cross that last year. So we are rather but yeah, I mean, this is also in the middle of the pack, or not very different from what's normally happening in EU. So what you should know again about Estonia is that we are in many sectors, we're constantly moving. 95% of health records are digital, and over 99% of drug prescriptions are currently digital. I will come back to the X-Road, which makes this possible. I will come back to that a little bit later. So we can be perhaps considered as an advanced digital society. Our government is digital, and there's quite a bit digital services that can be skills, infrastructure, and there's also legislation available for different digital approaches. Cybersecurity is an important thing to mention here, as we host one of the NATO cybersecurity research centers in Estonia. And IoT, 5G, blockchain, these are keywords that arise in the context of digital lifestyle, digital technologies these days quite a bit. So Estonia actually have tested how the digital health in blockchain might work, and there's some information about that as well, some experience. Now, I already briefly mentioned the X-Road. So the X-Road is a secure data exchange layer which was developed by Estonian government, and it helps to connect different data registries. And in theory, this creates the opportunity of not joining, but gathering data from different data silos, and some are mentioned here. For example, the patient portal, and patients can access their health data through the X-Road with their ID card. And Estonia has actually gone a little bit further and introduced e-residency, which is a governmental program that invites foreign entrepreneurs to come to Estonia and establish a company in Estonia. You can do this online, and you can run your company online, which makes it currently a little bit difficult is that to open a bank account, most often you still have to be present in Estonia, and I'm not sure they have found a good way around this due to a potential threat and with money laundering. But other than that, it's a nice scheme. There are quite a few companies established in Estonia that are actually run from abroad, and you don't have to come to Estonia to file your taxes, or you can do this online using your e-residency card and use the governmental e-services that are provided with the help of the X-Road. And just one small note here as well, that Estonians can also vote abroad using this X-Road or this exchange layer. And for example, I was in India during the local government, Tartu city government elections, and voted from my hotel in India for that, and that worked quite well. And when we talk about digital registries in Estonia and the X-Road solution, then similar or very similar solutions have been applied in other countries. And what we can talk about here is, for example, the e-prescription collaboration. Get an e-prescription in Estonia and then take your ID card to Finland and buy from the pharmacy the drugs you need, and vice versa. The same thing with Finland. And this is a part of a bigger European approach, bigger European exchange, or this kind of a free movement between different countries would be available. I'm getting a notice that my internet connection is unstable, so please let me know if I disappear or if this is lagging. Ellery also knows my phone number, so she can give me a call in case something happens. Now, when you're entering Estonia, it's good to have a contact point. It's good to have someone who can help you move forward. So we present Tartu Health here a little bit. Tartu Biotechnology Park is the is the organization that organizes the activities of Tartu Health Cluster. ScanBalt is an organization that takes a look on the Baltic Sea Region level regarding the countries that are around Baltic Sea, and opens opportunities for companies in this area. We have to consider that there we have also Finland and Denmark and Sweden, which are all very highly developed. The Connected Health Cluster is another cluster in Estonia that contains several digital health startups and major players. And this is managed by Science Park Technopole, and Medicine Estonia is a medical cluster that they're not currently very active as far as I know. Maybe I'm hoping I'm not being too harsh on them, but their main activity was the medical tourism and helping people reach Estonian medical services physically. So briefly, just a few words about Tartu Biotechnology Park. We are a rather common science park, which means we contain lab and office space and offer both business development services and actual physical release. We have our own small incubator where we can help companies with the Estonian market, but also going forward when they come from abroad. And I'm getting a message that maybe I should try to turn off my camera. I hope this will be fine with you. Hopefully the overall presentation will not suffer much. So sorry, I will just try to turn it off here. Let me see where I can find it. Okay, I'll stop my video and let's come back to the presentation. So sorry about that. And in the incubator, we work with sort of companies, and they can technically also be from abroad. And we do quite a bit of collaboration all over Europe. For example, the CELIS project I already mentioned, but there are many others. With the Big Plus project, we develop guidelines for biomarkers, and we are also EIT Health Risk Hub, which means we work with Estonian ecosystem jointly with EIT Health, and Genera is another project that works with companies in the genomics area and helps to find new markets and new market access for those companies. We're also part of Estonian Connected Health Cluster, as already mentioned, and we're part of different collaboration networks in ScanBalt, in Submariner, Estonian Connected Health. We do quite a bit of collaboration with different parks in Europe, and also our co-organizer Startup Day Business Festival. So this hopefully gives a little bit of background of how we can help you and what are our competencies. Briefly about ScanBalt. So as I mentioned, ScanBalt is a similar network. It's a cluster of clusters, or a meta cluster around Baltic Sea region. And the aim of ScanBalt is they offer also communication and regional competencies. They provide market access to different markets. They act as a project accelerator. They're a think tank, and also importantly networking. So currently the organization contains members from Sweden, Finland, Estonia, Latvia, Lithuania, Poland, Germany, Denmark, and Holland. So through the clusters, there's also an opportunity to access different markets. Now, going back more specifically to Estonia, what you need to know is that the healthcare service in Estonia is managed by the governmental organizations. So how it works is that the health is financed under Ministry of Social Affairs, and they have a specific body for this, the Health Insurance Fund. And the Health Insurance Fund is the body that finances all healthcare services which are not privately managed, and they also fund some of the private hospitals and private clinics and their healthcare services as well. I briefly mentioned TEHIK. TEHIK is the organization that has developed the X-Road and I think this was Information System Authority who created the X-Road, but TEHIK is responsible for creating the health and welfare information system, and they are managing the everything that is related to the patient data and access to this data. And National Institute for Health Development is a sort of R&D sort of development organizations. They provide insights on the health of people. They do investigations and research how the Estonian health is doing, and based on this, they provide suggestions to Ministry of Social Affairs and how they should be running the Estonian healthcare system. There are quite a few research and CRO capabilities, which when you're entering Estonia might become handy to make sure that you are developing your project in the right way, in the right direction. Of course, University of Tartu is important to mention here. They are the largest university in Estonia, and they get about half of Estonian science funding and provide more than half Estonian scientific outputs. They're also the only university in Estonia that is able to teach medical doctors. The Institute of Clinical Medicine and Tartu University Hospital jointly provide help with many clinical trials and two clinical trials, for example, and are quite active in collaboration and helping companies move forward. What I would also mention here is the University of Tartu Institute of Genomics and Estonian Biobank, which are a population-based biobank currently holding more than 200,000 DNA samples from a common population of Estonians, and they're very open to collaboration with different companies and have done many collaborations over the years. One that comes to mind, good collaboration with startup BioAge that has, with the data received or with a R&D work received from the Institute of Genomics, has raised, I think currently, recently they raised Series B and received quite a bit of venture capital funding in the States. There are a couple of more hospitals and universities. North Estonia Medical Center is, of course, a large medical center. CELIS is another university that works towards digital health and helps to figure out which way the digital health society should be moving. And we have a couple of healthcare colleges and Tallinn University as well. A couple of CROs I'd like to mention here are Tehnoloogia Arenduskeskus or Technology Development Center of ELICO. They are more, and also the STAC, they are more on the ICT side. The Competence Center of Health Technologies is more on the health side. So when we're talking about digital health, then the collaboration of these organizations might help you develop your project. Some of the recent example project and support infrastructure is that, as I mentioned, the e-prescription service, and which is now currently tested and piloted and working jointly with the Finnish system. E-consultations and e-monitoring, here I have marked the HIF, which is the Health Insurance Fund, and the COVID-19 pandemic gave quite a push towards e-monitoring and e-health services, e-health consultations. In Estonia, the numbers, as in other places, rose, and currently Health Insurance Fund is developing new guidelines for e-monitoring and will be piloting with a couple of companies the e-monitoring system, so that people who need regular visits to the doctors could do this through an app or online in some ways. Hoia is an app for COVID-19 pandemics, which many countries have a similar version, and where phones communicate through Bluetooth, and if a person is tested positive with the COVID-19 test, then everyone who has been in contact with the person will get a notification that they were in proximity of that person. I briefly already mentioned Estonian Biobank and Genome Center. And Nutikas is a smart specialization measure that would help companies that want to have an Estonian legal entity to ask for support from Estonian government to perform R&D activities. So depending on the activity, 70 to 45% of the activities will be reimbursed by the Estonian government. But this measure just ended, but as far as I know, a very similar measure will be opened in the upcoming month for the next framework period. So the main topics now in Estonian market, and when you're thinking about entering Estonia, is of course data interoperability. So in Estonia, even the hospitals don't always communicate freely. The hospital systems, the ICT systems, digital systems are not directly compatible. So we are working towards that to have a good set of standards and be able to allow the data exchange between different entities. This, of course, requires some investments into digitalization, and maybe there are some opportunities here as well. What, of course, is a limiting factor here, and what has to be kept in mind is the amount of innovative tenders from the government sector, from the public sector is rather limited. I mentioned one from the health insurance fund when they will be piloting some of the services in the Estonian market. So this could be an opportunity maybe for the companies. I mentioned in the very beginning that we're a small market. We're a market that can be used as a sandbox and to play around a little bit with opportunities before entering a larger market. And there's quite strong public and private sector collaboration. So the public sector is directing in a way the bigger steps in Estonia. As I mentioned, the recent developments are road ahead. There will be teleconsultations, and distant monitoring will be one of the main topics. So what are the market growth and opportunities? I think the healthcare systems got a rather big push from the COVID-19, but if this is sustainable, I'm a little bit cautious in stating this. So I don't foresee very big increases in the market growth in Estonia. One thing that will be looming in the near future is hopefully the use of genetic data, especially in prevention, with the help of Estonian Genome Bank and all the research they've been doing, figuring out what kind of genetic markers are responsible for what kind of phenotypes in a person's lifetime. So that was briefly from me. This is not my picture here. This is Annaliisa's picture, as she is the manager of the project from the lead partner BioRM side. You can see the general information about the CELIS project, and also Annaliisa's email and also my email down below. You can contact me or Annaliisa if you have any questions about the CELIS or entering Estonian market. And if you have any questions now, I'd be happy to answer you. So thank you.